All right, we're back to live, and I am so excited to have Dr. Ben Thrower with me, who is the MS director at the Andrew Carlos MS Center in Atlanta. And Ben and I have a history. We probably go back about 22 years when
A
I was
few
first
years.
got. I know, isn't that something? And I
Yeah.
have followed Ben on social media and at medical programs. And then when I'm really lucky, I get to pop in Atlanta and visit you and everybody at the Shepherd. So welcome to our launch for MS Insight.
Thank you.
Now, I am not even going to let you talk too much about yourself, but please tell everybody what you do. And then I'm going to start. I have some great questions for you.
Absolutely. So I am the medical director here at the Andrew C. Carlos MS Institute at Shepherd Center in Atlanta, Georgia. I am a neurologist. I've been here in Atlanta for about 20 years now. I think you and I, Wendy, met when I was in Spokane, Washington at the Holy Family MS Center. My other sort of thing that I love doing, my wife is a pediatrician, and we do quite a bit of medical work in Nicaragua. We work with a group called Connect and try to get down there at least twice a year to do special needs patients there in some of the rural communities of Nicaragua.
And I've been threatening to join you, and one of these times I'm going to. Last year, of course, you couldn't. Did you go this year with COVID, or were you?
We went in February, just before COVID hit, and of course didn't get to go in July, which would have been our second trip. But we've got a pretty good ground game there with healthcare providers that we are able to support. So all of the work carries on, even if we're not able to physically get down there.
Oh, I am going to join you. All right, let's get on to MS. My very first question is, as a physician and a neurologist who treats multiple sclerosis, what do you tell the newly diagnosed patient the very first time that you have just told them they have MS? Then what do you do?
So I tell people with MS that we're going to educate you. We're going to talk a lot about MS, but the first thing I want them to do is to take a deep breath and realize that our goal for you with MS is for your MS to be boring. I want us to address your MS appropriately, but I want your MS to be as small a part of your life as possible. I feel like we have enough tools now that we can, in many people, stop their MS in their tracks and hopefully let them carry on with whatever their life plans were, their work plans, their family plans, and let them fulfill their dreams. So again, it's that take a deep breath. We're going to educate. We're going to deal with this. I think the first year for people dealing with MS is probably the hardest. You're knocked off of your axis. Mm-hmm. You're trying to figure out where this new diagnosis fits in your life. But again, I think for most people, we can make MS as small a part of their life as possible.
Oh, I love hearing that. And that is a big change in the last 22 years. So I feel very lucky that you and I have grown into this and can tell a patient that. Now, you have the benefit, and the people around you in Atlanta, me up here in Boston, of being close to some of the best MS centers in the country. But I often wonder, what if about a patient who might not be close to a national MS center or a center of excellence? What do we tell them?
So MS management really does take a comprehensive and integrated team. So MS management is a lot more than just a neurologist. It really should be physical therapy, occupational therapy, counselors, case managers, neuropsychologists, and ideally the person, like you said, would have access to a comprehensive center. If you don't, maybe visiting somewhere like that, once a year. So you go from your more outlying community to a comprehensive center just to get a tune-up, just to find out what's going on in the world. If that's not possible, then trying to recreate that comprehensive MS center in your community, finding out who is the best physical therapist, who is the best occupational therapist within your community, and trying to help those people communicate with each other. Comprehensive care is important, having all the pieces of the team, but having those players talk to one another is just as important. So having integration within that comprehensive team is going to be vitally important also.
I agree. And it is true that maybe once or twice a year, I've even been at my MS center where people from Europe have come over just to get there. So it is something to consider, that if you have a way to get there, bus, taxi, a friend, an airplane, to get to one of the centers would be most helpful. And a lot of that information, hopefully you could take back with you.
Absolutely.
Okay, now a hard one. And this is all, again, our MS Insight is really being led by patients. So I'm coming at you truly as an MS patient. We get bombarded with well-meaning people, and they have some wonderful ideas and wonderful suggestions, and at other times some crazy, like getting rid of your dog was around a lot 20 years ago, and having the amalgam removed from your teeth. Now we have the internet and telemedicine and WebMD and things like that. I'm the first one to diagnose myself on the internet. How do we dispel, how do you work with fact and fiction, especially in multiple sclerosis?
Yeah, that's a great question. It's tough because it's a blessing and a curse that we have so much information at our fingertips, but at the same time, it's like trying to drink from a fire hose. It's too much coming at people. So, in regards to friends and family, bombarding you with things, I think just sometimes a filter, being polite, taking the information and saying, I'll look into it is really all you need to do. You've got a lot of great reputable sources out there, whether it's the National MS Society, the Multiple Sclerosis Foundation, the MSAA, all of these different groups can serve as a sounding board. So if you see something on the internet, you see it on Facebook, you don't know if it's legitimate or not, or a friend or a family member gives you something and you don't know if it's legitimate, you take it to one of those groups, look online at the National MS Society and say, because chances are if it's been put out on social media somewhere, one of these organizations has written something about it and has an opinion on it. It can give you some guidance.
Oh, that's really good advice, because it is really hard and it changes. And the person who tells you, of course, is telling you like they have got the next best answer to a cure. So it's really hard as the patient to not buy into that and to stay sane and say, well, let me find out.
Yeah, people mean well. I mean, they want to help.
Yeah.
And so I think, again, just being polite about it, taking the information, but saying, let me run it by some of these other groups. And, ultimately, that's what your healthcare team is there for. Your healthcare team should be there to be your guidance counselor, and so for you to run those ideas by them.
Mm-hmm. Now, you are probably the most prolific speaker out there. I was so excited that we even got you, because every time I turn around, you're speaking. So let me ask you, what's your favorite topic in MS? I'll keep it to MS, but what's your favorite?
So I think it's evolved over the years. I mean, you've seen, we went from 1992
Mm-hmm.
having 0 FDA approved treatment options. So now here we are in 2020 having, 21 FDA approved treatment options. So I would say it used to be talking about disease modifying therapies,
Mm-hmm.
which I think is still important. Now I'm more drawn to things that really deal with quality of life and improving someone's quality of life. As we focused more on the immunology of MS, I think it's sometimes to the detriment of going back to the things like gait, walking. I love talking about walking in MS because it feels like it gets overlooked a lot. And the majority of people with MS do have at least a little bit of a walking issue, sometimes a lot of a walking issue. And so I love talking about gait issues in multiple sclerosis. One of my other things I like talking about, because it's an area of interest to people with MS, and there's so much misinformation, is cannabis in multiple sclerosis, because you've got this quilt of different laws across the country in regards to medical cannabis. You've got federal laws, state laws. We have over-the-counter CBD oil that's available, and there's so much confusion for people with MS as to, is this legitimate? Does it offer me any benefits, in managing my MS? So that's an area that I find myself kind of drawn to. When we do our local programs here at Shepherd, we do a monthly program. Of course, this was pre-COVID when we could still do them in person.
Mm-hmm.
Pre-COVID, we would get about 50 people on average up in our auditorium here at Shepherd for most of our programs, and then we would, videotape it and put it out for later use. When we would do a cannabis talk, though, we'd get 200 people, typically.
Oh, wow. I went to the sex talk, though, and that one was fantastic.
The sex talk is, I like, those are fun.
Yeah, and I couldn't believe the audience, how open and candid they were, and what a great dialogue they had going. And you had some wonderful patients in there who cracked me up, but they had really valuable things to share. So
Absolutely.
that's another one and it was a full house.
Yep, it was.
Okay, so that kind of leads into to what do you see as the future for the MS patient, especially now during COVID? Telemedicine is, we didn't even talk about that a year ago. So the future of MS, that's again a very broad question because it can pertain to disease modifying therapies all the way to meeting with your physician.
I think that we're going to see, I would say, therapeutic optimism. We've gone from having no MS treatments available to, in the early years, back in the early 90s, we had treatments, but everyone kind of thought they were the same. And now we realize that there are differences in the treatments. And I think it's okay for us in the MS community to be a little bit greedy with what we want. We want people to have no relapse, no progression of disability, no new MRI lesions. And so that the thought of being as aggressive as humanly possible in reaching out for those goals, I think is the new norm in MS. I don't think it's okay to settle for saying, well, we picked a treatment and you're having some disease breakthrough activity, but we're doing the best we can. I think we do have enough treatment options that we can be appropriately selfish. I think we are getting closer and closer to the idea of reversing disability. Right now, everything we do in MS is put into one of three boxes. We either treat relapses, we manage symptoms, or we stop disease progression. Hopefully there's going to be a fourth bucket there soon, and that's going to be reversing disability. And I do think we're getting closer to that.
Oh, I hope we can pick up. I'd love to interview you again and talk a lot about that because I
Absolutely.
think people with MS are clamoring for that.
Yeah.
Then, so what do you tell the patient who says, I've been diagnosed and none of the therapies work?
So I think first off, we want to make sure that we're on the same page. So when someone says their therapy didn't work, do they mean that it didn't stabilize their MS, or do they mean it didn't make them better? Because as you know, most of our therapies are not designed to make people better. They're designed to slow down the process or keep you from getting any worse. And so we want to make sure that we're on the same page with that conversation, that there were realistic expectations in what the person wanted. And then make sure that the person really has given all of the reasonable options a reasonable trial. Was the person on a treatment for too short of a length of time, or did they have side effects that precluded them from really giving it a good try? So we do sometimes run into individuals, unfortunately, who really have tried everything and they are still progressing. Progressive MS is, I think, one of the biggest challenges that we face in the MS community. And we hear this every day. Someone's on a good therapy. They're not having new lesions on MRI. They're not having relapses, but they say, you know what? I'm still kind of doing this. I'm getting a little worse. And we believe them. We know that happens. Sometimes we do reach a point where we've tried everything and that person is still getting worse. We want to make sure that we're not missing the other part of treatment in that person, and that's the wellness and rehabilitation aspect of MS. Because when we think of the bucket of disability in MS, some of that bucket is made up of damage in the brain and spinal cord. Some of that bucket in most humans is made up of deconditioning. Very few of us, MS or no MS, are exercising to the degree that we probably should. So we've learned over the years that getting people with MS into a good reconditioning program, whatever that looks like for that individual, is going to probably improve their level of functioning.
Wow. Now, going back to COVID, and these questions you didn't know about, but interestingly enough, back in March, I was driving across the country to move from East to West Coast or West to East Coast and heard your interview with, I believe it was with the MS Foundation, about COVID and patients with MS getting their therapy. And it came at a perfect time because I was trying to decide if I should go in for mine or not, being afraid to go to the hospital. Has that changed? Are people with MS making sure to get their disease modifying therapies, or is things different because of COVID?
So, I mean, COVID has obviously changed life in a lot of ways for globally, including for the MS community. So early on with COVID, none of us knew how long this was going to last, and I don't think most of us thought that we were going to be still having this discussion in September of 2020. We still don't really know how long this is going to last, so we can't put people's MS lives and MS treatment plans on hold indefinitely. So right now, for the majority of people with MS, we are recommending that they carry on with their treatment plan regardless of COVID, but do it in a way that's as safe as possible. So, many people with MS are on infusions, natalizumab or ocrelizumab, alemtuzumab. And so there were some challenges early on, sometimes with infusion centers being closed. Most of those infusion centers are back up and running. Or there are alternatives for people continuing their therapy. So there have been challenges, but I think for the majority of people with MS, we want them to continue on with their treatment. There's a ton of data out there now on COVID and MS. We know that for the average person with MS, that they're not at higher risk for COVID. They are not at higher risk for getting sicker if they do get COVID. People with MS who are doing poorly with COVID tend to look a lot like people without MS who are doing poorly with COVID. They are older individuals. They have other health problems. They have hypertension, diabetes, COPD. Probably the only thing that has changed is we've based upon the Italian data and some data in the U.S., we are recommending maybe a little bit of a caution in patients on Ocrevus or Rituxan. Those drugs may be associated with a higher risk of hospitalization if you were to get COVID. But again, I think if we're doing our job appropriately at the medical end and doing appropriate safety monitoring, those individuals on those drugs can also be managed very, very safely.
Oh, that's great to know, because I agree it's going to go on a while longer.
Yep.
Okay, last question, and this too is very broad, but what if a patient wants to get involved in a clinical trial or research? How do they go about that?
So, I would certainly talk to your healthcare team. If the person with MS is at a comprehensive center, chances are they're doing clinical trials there. So it never hurts when you go in for your visits to say, hey, what do you guys got going on now? Am I a candidate for anything? Don't forget to ask about trials in exercise and rehabilitation, because to me, those are the most exciting trials that are out there. That they're frequently very low risk trials. There's usually not a placebo group. There's not the risk of drug side effects. So ask about exercise and rehab trials. Ask about what drug trials there are going on. And if there aren't any, maybe that individual is not at a comprehensive center, maybe when they are seen on a once a year basis at a comprehensive center, they can talk to those folks about what's going on. People can also go to clinicaltrials.gov. So that's the federal website that lists all trials, not just MS, everything. And then search under multiple sclerosis. You'll see what trials are going on in a given area. So, like for us here at Shepherd Center, we might be doing 10 clinical trials at a given time. Maybe they're not all recruiting though. Maybe they're full. And so we might only be recruiting for 1 or 2 trials at a time. But maybe there's a comprehensive MS center nearby that might be doing other sort of trials. So it's worth going to those clinical trial sites to know what's going on nationally and then in your area.
I learned last year or the year before when they had CMSC, I met with the NIH and heard the value and the incredible value to the patient of getting involved in one of these trials. And that's when it started to pique my interest. So I'm sure a lot of people with MS didn't think they were either qualified, didn't know how they got in. And so thank you for that information, because that really is almost makes you feel like you're part of the solution instead of the problem. It really does put you in a place where you can say, I can offer something.
It's interesting. I think you hit it right on the head. When people with MS have been interviewed about why they want to participate in a clinical trial, the number one reason that people in the MS community want to participate is to give something back. So people want to take care of themselves and be healthy, but people also have a sense of altruism, and they do want to help out the rest of the MS community and help us get to a point where we have a cure.
Hey, do you still is salumedrol and steroids still used when there's a flare-up or inflammation, or because of the disease-modifying therapies, are you seeing less and less of that?
We are definitely seeing less need for salumedrol, but it is still the old go-to. So in the United States, we typically do 3 days of IV salumedrol. You can also convert that over into a high-dose oral prednisone. So there are a lot of different regimens out there for treating relapses, but you're absolutely right. Because of more effective therapies, we are finding that we just don't have as much need to treat relapses. When I started here at Shepherd in 2001, we did an interesting sort of analysis looking at just monitoring MRIs. So these were patients who typically were on the old platform therapies, your Avonex, Betaseron, Copaxone, Rebif type drugs, and they're getting a yearly MRI. And they feel fine. And what we found in our surveillance MRIs is that upwards of 50% of those individuals who felt fine still had new disease activity on their MRI. Now, fast forward to 2020, it is so unusual to see people having asymptomatic MRI lesions when we look at some of the therapies like, natalizumab, ocrelizumab, the fingolimod, those types of drugs. I think we've really upped our game in terms of being able to put the brakes on people's MS.
Boy, it must be very rewarding for you, having been in the MS world all these years, to see it go from no therapy to the first round of therapies to now. Must be amazing as a treating physician.
Just light years ahead, I mean, of where we had been.
Well, I promised you 20 minutes. I could ask you a million more questions. So I want to leave it that I can bug you again and say, would you come on again? I have more for you. I would love it. And thank you for helping us launch. As I say, you and I have a history. We've had a lot of fun together. I don't want to lose you. So I'm going to continue to circle the wagon. We also love that we're at a spot where we're going to share all our information with the other MS organizations. So because the more that the patient learns and the less fear they have. So you've been a huge help, especially for those newly diagnosed. Take care of you. Kiss that grandson for me.
Absolutely.
And thank you so much for being part of our launch today with MS Insight. And if we get any other questions, I will send them off to you, or I'll get you back soon.
And thank you for all you do, Wendy. You have done a lot for the MS community, and it's much appreciated.
Well, I learned a lot all these years, struggling up those